Hey everyone, welcome back to my story Living with Lupus. I'm Susan Hendricks, and today we're diving into a topic that many people with systemic lupus may not be aware of: Discoid Lupus Erythematosus, or DLE. Yes, you can actually be diagnosed with both SLE and DLE. Let's break down what that means, how common it is, the signs and symptoms to watch for, and the current treatments available. Discoid lupus and systemic lupus. What you need to know. Discoid lupus is a chronic autoimmune skin condition that causes red, inflamed, disc-shaped lesions, typically on sun-exposed areas like the face, scalp, and ears. And yes, you can have both. According to the Lupus Foundation of America, about 10% to 30% of people with systemic lupus erythematosus, SLE, will also develop discoid lupus lesions during the course of their illness. DLE is the most common form of cutaneous lupus, and it primarily affects the skin. Unlike SLE, which can impact internal organs, DLE is generally limited to the skin. But that doesn't mean it's less serious, especially if it's left untreated. Here are the most common symptoms of discoid. Lupus round, coin-shaped red or purple lesions, thick, scaly plaques that may scar over time, skin discoloration, either lighter or darker than your natural skin tone, hair loss if lesions appear on the scalp, and an itching or burning sensation. These lesions often appear on areas exposed to sunlight, which is why photosensitivity is a key factor. Diagnosing discoid lupus often requires a skin biopsy, which your dermatologist will perform on one of the lesions. Blood tests can also help rule out systemic involvement if you already have a diagnosis of systemic lupus erythematosus. Treatment focuses on reducing inflammation, preventing scarring, and protecting your skin. Common treatments include topical corticosteroids to reduce skin inflammation, anti-malarial drugs such as hydroxychloroquine used both in SLE and DLE, intralesional steroid injections for stubborn or thick lesions, sun protection, which is critical for managing DLE. Always wear SPF 50+, and lifestyle changes, like avoiding smoking, which can worsen skin symptoms. Always talk with your rheumatologist or dermatologist before trying any new treatments. What works for one person may not work for another. If you're living with SLE and start noticing persistent rashes or scarring skin lesions, don't ignore them. Discoid lupus is manageable, especially when caught early. Remember, knowledge is power. By understanding how these two forms of lupus can overlap, you're one step closer to taking control of your health. Have you experienced discoid lupus symptoms along with your SLE? Drop a comment below and let's start a conversation. Don't forget to like this video, subscribe, and hit that notification bell so you never miss an update from my story Living with Lupus. Stay safe, stay informed, and as always, take care of yourself. Subscribe, like, and share. My story Living with Lupus, empowering lives one story at a time.